Good morning, ladies and gentlemen. Thank you for joining us for today's event provided by Renew Canada in association with the Infrastructure, Health and Safety Agency, ResCon, and LiUNA 183. My name is Andrew Macklin. I'm the managing editor of Renew Canada, and I'm pleased to be your host and moderator for today's event. Before we get too far into our proceedings and start what I'm sure will be an excellent discussion this morning, I just want to let everybody know about the interactivity opportunities that are part of today's conversation. So as I'm sure you can see on the right-hand side of your screen, there is a chat function. Please use that. Introduce yourself to the other people that are taking part in today's event. Let them know where you're from, what you do. We're always interested to try to build some networking in today's event and make sure that you have the opportunity to meet some new people who are in similar situations to you, trying to learn more about what construction health and safety is going to look like in the post-COVID-19 Canada, or even as we gear up for what could potentially be a second or third phase of the pandemic in the months to come. I want to give you some attention to the bottom part of your screen. See, there's a couple opportunities for you to get involved in today's conversation. First, take a look at the polls tab that's at the very bottom of the screen. We have several polls that we are asking everyone to participate in today. Really interested in getting your feedback, getting some information from you as far as your thoughts on some very key parts of today's health and safety discussion. Also, if you see the Ask a Question tab along the bottom, that's your opportunity to ask questions of any of our speakers today. And throughout our presentation, we'll be taking the time to take a look at your questions and do our best to address them. If you also look, you'll see a votes feature. If you see a question that you would like to ask, but of course has already been asked, click on that vote part of the feature. That will raise that question to the top of the questions. Realize for us that it is a priority, that there are more than one people that would like information, like an answer to the question. And like I said, we'll do our best throughout today to try to get your questions through and try to get everything answered. And of course, we'll make sure that we have information for you to contact people as well throughout the day. You'll also see right below the screen, there's a little green button. Right now it says Renew Canada. And throughout the day, we're going to be rotating that to links to different websites that are from our representative speakers. Right now, that's renewcanada.net, which of course is the home of our news and information site here at Renew Canada. Canada is a public source for information on the public sector infrastructure industry. As well, just a reminder that if you do have to drop off today's conversation, or you have colleagues that would have liked to have been part of the conversation but were unable to be here live, within a few hours of this broadcast ending, you'll be able to come back to this exact same link and be able to access the presentation. Also want to let you know that in the coming days, there will be a news story wrapping up some of the key points of today's conversation that will appear at renewcanada.net. And as well, there will be a full-length feature on this issue that will be presented in the September-October edition of Renew Canada magazine. If you have any questions, like I said, please ask them throughout today's presentation. We are looking forward to having you as part of the discussion, and we hope that you will be an active participant in today's conversation. Before we get to our three speakers for today, I want to take a moment just to tell you a little bit about why we're here and why we're having this discussion. And obviously, when the COVID-19 pandemic hit, a lot of people were sent scrambling, and it was very difficult for the construction industry to definitively understand what needed to happen on construction job sites throughout Canada in order to make sure that health and safety standards were being met in the wake of a pandemic that no one saw coming and was like something we've never seen before here on Canadian soil. We've seen the reaction that the construction industry has had, and they've done their very best to be able to keep all workers safe on all job sites across Canada. But what comes next? And what are really those medium and long-term impacts from what we are seeing as a result of the pandemic? And really, how do we prepare ourselves in the event that another disruptive event, be it a pandemic or anything else, causes us to have to react on our job sites once again to be able to issue new health and safety protocols? We'll discuss these topics and more throughout the next about hour and 23 minutes that we have with you today. But this time, I'd like to start welcoming our speakers. First, I'd like to welcome Andrew Pariser. If you don't know Andrew, he is the Vice President of the Residential Construction Council of Ontario, And that no matter how many times I've said that, I always make sure I have that written on my paper because I'd hate to get that wrong. But Andrew is the guy that you want to go to for all questions about health and safety, especially policy and governance in the industry. And we're very happy to have Andrew taking part in today's conversation. Andrew, thank you so very much for joining us today. Before we get to Andrew, we want to welcome as well Sandro Pinto. Sandro is the LIUNA 183 Training Center Executive Director, and he'll be joining us shortly on the line as well. Of course, LIUNA 183 runs 6 training centers throughout Southern Ontario, in Cambridge, Toronto, Vaughan, Barrie, Cobourg, and in Kingston. And our third speaker for today, there's Sandro. Thank you very much for joining us.
Morning.
And our third speaker for today is Enzo Garritano. Enzo is the President and Chief Executive Officer of the Infrastructure, Health and Safety Association and has been in that role since June of 2016. Gentlemen, thank you so much for being a part of today's conversation that I know that our audience will greatly benefit from hearing from such high level of expertise on the issue of where we're going and where we are now in construction, health and safety. So let's provide a bit of a scene setter here for today's conversation, which is, so the pandemic hits and all of a sudden it's the middle of March and we've got this fast spreading virus that no one really understands, but we know that it's contagious and we know that it's jeopardizing the health and safety of the people in our community. I want to start with you, Andrew, if I could. I'm just kind of curious to know what exactly it was that our construction industry was able to do in order to be able to react to what was happening.
So first off, we immediately recognized this as a health and safety and really a health issue, and we implemented the health and safety system. And so that involves, Sandro on representing unions. It involves Enzo with health and safety providers and agencies, and it involves the Ministry of Labor. And as everybody knows, the first thing you do when it comes to health and safety is you try to identify the hazard. And so we quickly had to gather as much information as possible. And then obviously the next step is communication. And so there was coalitions created, and to be honest, they were already in existence. And so we're able to quickly use existing networks to understand the hazard and then figure out ways to eliminate and or mitigate it, especially with the case of COVID-19. So in short, it was all hands on deck. We needed to gather as much information as possible. We needed to communicate throughout the industry with the government and with government partners like IHSA. That was kind of our initial reaction and first steps.
Well, let's flip it over to that IHSA perspective. Enzo, how was the reaction on your side of things? What happened in those first early days?
So it was, first thing, thanks for having us. Appreciate being part of this. Definitely in March, when this all really came to a head, a lot of people did get together very quickly. As Andrew said, we do have a network of engaged labor and management groups. So we leveraged that, and we certainly work very closely with the Ministry of Labor, with the public health departments and the Ministry of Health to put together guidelines that were acceptable and reviewed by industry, had a lot of input by industry on things that are able to be done, things that are, instead of putting things pie in the sky, it was more about, boots to the ground, what can you get done? So a lot of that material was put together. Certainly our staff worked very hard. The ministry staff worked very hard. A lot of appreciation there for the feedback and to get these guidelines in place and then communicate them out through the network, through the likes of ResCon, through LIUNA, through our other associate stakeholders, is to get that information out as fast as possible, starting with the highest level pieces about what you should do as an employer or a constructor on site, and then cascading down to the employers, cascading down to the workers, subcontractors on what is required. And a lot of it was hygiene. A lot of it was getting back to the basics of making sure there's places to get cleaned up, making sure that the cleanup stations are well equipped and cleaned and all that kind of stuff going forward. So it's really a lot of information to get people's anxiety levels low so they can get back to work and do it without the consideration for the virus, or at least putting that to the back of their heads a little more than it was so in front.
Absolutely. Sandro, from your perspective, what did the early days look like as far as the concerns that you were hearing from people in the LIUNA union and from the workers that were on the job sites?
You know, in the early days, I think that there was so much information being sent out there from the media on so many different aspects of what was happening around the world that the construction industry was one that concern, obviously, right? What's happening, what are we doing, how do we move forward with things, can we move forward with things, should we be doing this, I heard this on the news, and how are we going to progress and make a living and continue feeding our families, and can I go to work tomorrow, should I be wearing gloves, should I be wearing a mask, how come there's no masks here, and all that type of confusion, as the media and all of the different messages that were being sent out in the public, I think affected not only the construction industry but everybody. So definitely confusion and a sense of what are we going to do next, and how are we going to kind of move on with this, and what kind of structure is there going to be for us to continue working or not working, as we saw with what happened with the province.
Interesting you bring up the confusion aspect, because I know from a conversation I was having with a gentleman out in British Columbia, he was saying that was one of the key issues they faced, which was making sure that contractors running these job sites were 100% clear who exactly I am listening to, in order to ensure that I am putting the proper health and safety protocols in place. And Andrew, I'm just wondering, from your perspective, is this something that was at all a problem in Ontario in the early days, or was it perfectly clear from the get-go that yes, even in this situation, this is who you are specifically listening to for guidance on health and safety?
I think there's two ways to look at it. So one, this was a global pandemic, and even a week or two before the pandemic started, everyone was told, this is gonna go away. It's not gonna be a big deal. And everyone from World Bankers to the World Health Organization was playing it down. And then I think we got into early to mid March, and I think it was March 16th. All of a sudden, there's a shutdown. So construction, just like the rest of the world, definitely could have been more prepared. But the way that we sprung into action, so if we're all thinking about a boxing analogy, we were definitely knocked down in the first round, but we got back up, and we got back up quickly, and we were able to really rely on that network. And I think, as far as was the message clear, yes, it was. I think there's clear health and safety leaders in this province, whether it's some of the groups that ResCon sits on, or we just lost Sandro, but obviously 183 is part of that, as well as IHSA, the Ministry of Labor, and the Chief Prevention Officers. And I have to compliment the ResCon Health and Safety Committee, ResCon members, and the ResCon Board of Directors. When the pandemic hit, everything stopped, and our only focus was on health and safety. It was on how do we get the information we need to keep workers safe. Full stop. And so we do a lot at ResCon, but on March 17th, we only did one thing. And so as far as leadership and clarity, I think it was there. And I think it was reflected in the fact that construction was the first industry with guidelines. And through the IHSA, they were endorsed by both labor and management, which I think in the health and safety world is very important, but also speaks volumes to that health and safety community that we have here in Ontario.
Enzo?
Yeah, so for the listeners, if they don't know, we are a designated health and safety association under the Occupational Health and Safety Act. So we work very closely with the ministry. We work, and the Chief Prevention Officer obviously oversees our activities. And again, having that trust in what the content is coming through. And that's why it took a little bit longer than we wanted to. And, but by the time things got vetted through the Chief Prevention Office, through the Ministry of Labor, Training, Skills and Development, as well as the Ministry of Health, I think a lot of the industry, with their stakeholder input, had faith that that was the resource that you should go to. And that's what we kind of hang our hats on. We've been around for 100+ years serving the industries, and that's what we rely on. That's what our mission statement is, to be that trusted resource. So with the guidance of industry, with the work together jointly with the ministry and the Chief Prevention Officer, there's nothing else behind that except good information for the industry to go forward with. So we hope that the industry relied on that and continues to rely on that information. So you know where to go to get it. Because within that confusion of all the excitement around the issue at hand, and everyone going to work on knowing where this is going, it was, I think, more comfortable or more comforting knowing that, hey, this is agreed upon by all parties. As far as the content goes now, I mean, the best thing we can do now is to make it more usable by industry, so they can continue to use it in a more efficient and effective manner. And that's what we're doing now, going from the guidelines and heavy text into short videos, into webinars, things of that nature that you can log into and a little more readily get the content that you need to continue to keep your work site safe.
Just building on that a little bit, I'm just kind of curious, in those early days, like what were some of the key issues that had to be addressed as far as changing health and safety protocols that were currently in existence? What were some of those key things that really had to say, okay, we got to do this differently. We have to establish how we're going to do it differently.
Certainly, I'll maybe start on this one. Physical distancing was a huge one. Whether it's a construction site with areas where people gather, whether it's at a personnel hoist, or whether it's at the entrance or exits to the site, or in a home that's under construction or a condo, how do you keep that physical distancing in place? Certainly was one of the big questions. The other one obviously was, getting back to the basics, as I mentioned earlier, about health and hygiene on site, cleanup facilities, making sure that they're accessible, clean on an ongoing basis. And what do you do when you can't have that physical distancing in place? And those are questions that are still a little bit out there, but those are the types of information that people wanted to know. How do I keep my staff away from all eating lunch at the same time? How do I stagger the starts and finishes, the lunch breaks? How do I manage my schedule because of these issues? So those are some of the areas that were a little bit of a concern. I think, Andrew, you probably have a lot more in that, but certainly things that came up to our attention at that time.
Sure. And Andrew, from your perspective, what were some of those key issues that had to initially be addressed?
Yeah, so I think this pandemic was obviously there was a role for policy, but the tough part here was really implementation. So I think we very quickly figured out what you needed to do. And just to point to how quickly things changed, when the pandemic started, we were talking about social distancing. 4 or 5 days into it, all of a sudden it became physical distancing, because obviously you needed to distance in more than just a social setting. But I think people figured out what they needed to do. So, split shifts, increased sanitization, running water became key. Hand washing, it was the new thing. It was the year of hand washing in toilets for all of March. It's changing now where it's about face coverings and masks. I think as we figured out what to do, the only policy challenge was the fact that everything was changing so quickly. Things are slowing down considerably now, to the point where, you can give a member an answer and it might be good for 4 or 5 days now. Whereas when this pandemic hit, you would give them an answer and it was good for 4 or 5 minutes. So I think it was the increased sanitization, it was the staggered shifts, which helped when the noise bylaws changed from 6 a.m. to 10 p.m. It was reducing the number of workers on site. It was changing how work was performed. So how can we perform work, 6 feet apart? How do you schedule work so that not more than one trade is in a low-rise house? But the real challenge was, how does a builder implement this on site? It was easy to know what to do. It was very hard to do it. And that's where I'll go back to the health and safety committee that I work with, MOL inspectors and IHSA. They have, Enzo will know better than me, they probably have 100 resources on how you take, the construction policy that came out of MOL, which to my knowledge has been downloaded over 100,000 times now, and how you actually put it into practice. How do you actually work in construction, staying 6 feet apart as much as possible? And that implementation was the challenge, and obviously still will be today.
If I can add one more thing there, what the ministry did, and kudos to them for doing this, was to utilize our services as well as some other ministry services to get out to the sites and help the constructors with the consultations around how do you implement. Have a fresh set of eyes, getting out there, not to enforce and use the big stick, but to get out there and say, all right, this is what we see that's lacking, or this is what we see that's good, carry on, repeat it. But we had 30 of our own consultants out there. They had other ministries involved. And I think that's also gone a long way in ensuring and also giving comfort to the industry to say, hey, we're doing the right thing. And the industry has really stepped up in regards to getting a lot of these items in place and sustaining them. We've now been at it for over a month, and the results continue to come in very, very positive.
I want to build on one of the points you just made, because I know that when we were having our preliminary discussion in advance of this event, we talked about the Ministry of Labor. And one of the points you brought up that I thought was really interesting was this idea of not the Ministry of Labor necessarily going to job sites and saying, you're doing this wrong, you're doing this wrong, you're doing this wrong, but actually taking the time to get out to the site and consult and have a conversation and be able to work with the contractors to be able to make sure that, you know, they have the tools they need to be able to implement the new health and safety measures.
Yeah, and we work in a team there, and we report back. Certainly not on specific, you know, in generalities. We don't disclose when we're out there, but who the contractors are. But we do work as a team where we go out and visit the sites, provide some input, provide that consultation. The ministry may come in behind and do you know, the regular enforcement work, but again, it's more consultative at this point. We've done over, I think it's 200 and close to 300 consultations on site, with over 1,000 phone calls as well to companies, and talked about their environments and what they're doing and how they're doing it. And the ministry's coming in behind and also teaming up with the other ministries that I talked about. On those are also working a consultative role. So it's really hand in hand, working with the industry and trying to make sure that that everything is good. And surely they are going to use their enforcement requirements when they have to. But mostly from our end, it's been certainly on the consultative side.
Interesting. And Andrew, on that front, I mean, I'm sure it's been very important for your members to be able to have that opportunity to have those real on-site consultations, have somebody who can come in and really help them physically visualize their job site and what they can do to improve health and safety.
Yeah, I think a big message to employers is ask for help. You're not in this alone. You have association resources, you have IHSA resources, but every job site in Ontario, unless it's, you know, a very small job site, has a joint health and safety committee. And so this pandemic has taught us we're all connected. It doesn't matter if you're the CEO or if it's your second day on the job. When it comes to COVID, you have the same impact. If you're not doing your part, you jeopardize the entire operation. And so one thing that really jumped out to me, and I think everybody in the health and safety system knew it, is we have really strong partnerships in health and safety institutions in the province of Ontario. And a lot of them get back to joint health and safety committees that are on site and consist of, you know, on a unionized site, union and management and workers. And on a non-union site, obviously the union's not there. But this pandemic really showed us that the Ontario health and safety system is there to tackle really any hazard that comes up. And MOL did their part. Construction, obviously, because we stayed open, was a focal point. And we saw a lot of inspectors on site. We saw the enforcement, but we also saw the education. And I think that gave a lot of confidence to businesses, and it also gave a lot of confidence to workers. And so one thing when we're talking about health and safety, all our workers in residential construction are largely union members, but they're also our employees. And so construction is generally a family business, and there's a lot of businesses through the sub-trades and the owners of companies and builders, but the construction industry is a very small community. It's very tight, and we genuinely care about each other. And this kind of highlighted that. And it was nice to see people come together to protect everyone. And I think that was kind of the mentality that I saw throughout this whole thing.
Guys, there is one question that's already appeared, and I'm wondering if we could maybe address it. The question that came in was that I see construction workers on job sites who are working closely together and not wearing masks. Is that a case where they've been pre-screened before entering a site? Is that an opportunity that is already happening? Maybe Enzo, you can start with that, or?
Well, I think you know, we're getting more information from public health as well around the use of masks, and if they are within the 2 meter physical distancing limit, the recommendation is from public health, as well as you know, you hear it every day on the Chief Medical Officer of Canada and everything else, is that they do recommend the use of a mask, not to protect yourself, but to protect others from you coughing or you releasing droplets. So we certainly advocate for that. We hear it about, you know, if you're going to public transit, protect others from yourself. And if everyone does it, you've got, mass protection per se. So certainly if they're doing that and they're within the 2 meters, they should reconsider and try and use a facial covering in order to protect each other. Again, it comes back to the company's policies and how mature it is and how far they've gone along in understanding the risks and coming to solutions. So again, is it perfect? No, people are getting there. And the more information that is provided by all parties and good information, the more that people will start to move in that direction. It's pretty unusual to see people not wearing a mask when you're in a retail environment now, whether you're going to a large box store or whatever it is. You're odd if you're not wearing a facial covering, because people understand that, hey, we don't know who's got it if you're asymptomatic, so let's protect each other. And again, it's a social issue, right? It's about protecting each other and trying to wrestle this thing to the ground jointly. So hopefully they'll look at that a little more carefully and start using facial covers, as, again, I think everyone's starting to understand that we should be doing it.
Right. Andrew, anything you'd like to add on that perspective as well, about what we're seeing and how quickly we're seeing people transition to that level of PPE?
Yeah, and I think this isn't a new question. It's been around because obviously even in the policies we point to, what do you do on site, and if you want to call it face coverings, if you want to cover it masks, that's part of the policy. It's part of the procedure. We've worked on standards out of ResCon, and this is an issue we've discussed, and I know a lot of our members require it on site. I guess my first reaction is, I think when this all came out, the numbers came out, there's about 400,000 workers in construction. So even if we have 90% compliance, which would be phenomenal, you're looking, at a lot of workers that wouldn't be in compliance. And I think everyone's goal in health and safety is 100%, but I think we also have to understand the size of the construction industry. As we learn about pandemics and as we focus on COVID, there's fatigue, there's implementation issues. And so as the numbers go down, one thing that employers have to watch out for is complacency on site. Someone who wore a mask in March might not feel like a mask is necessary in May. And that's where we have to focus on implementation. We have to focus on consistency. And whether you're a builder, a consultant, a trade, a union, it's everybody's job to keep people safe. Everyone has a role in health and safety, and we need to articulate that. And we need to protect ourselves, but we also need to protect our colleagues and everyone else who's on site. So you wear a mask not for yourself, you wear a mask for your coworker's mother. You wear a mask for your coworker's son or daughter who is at a higher risk. And I think getting that message out, as Enzo pointed to, and really articulating why you need to wear a mask is important. I think the other thing, and I think the construction industry has started to figure this out, but certainly in March, the question was what mask is appropriate? And this is a pandemic that affects the entire world, the entire economy, and all of Ontario. And we need to save healthcare masks for healthcare workers. And so when we look at it, we recommend nothing more than a non-medical mask, surgical mask or below. And the reason for that is we all know what's going on in the healthcare system, and everyone needs to do their part. You can do your part in a couple ways. One, physically distance. Two, don't use PPE that the nurses and the medical professionals need. And three, follow the rules so you don't get sick. And I guess those are kind of the ways that we're looking at it. This is more than just construction.
And certainly, I think it's really important to note with that, you have to take a moment to recognize the efforts of the construction industry in Ontario when it comes to PPE, because, if you were tracking the donations that were made by this industry to frontline workers, it was phenomenal to see how well this industry stepped up, any stockpiles they had, and just got the donations out, got them to the frontline workers. And we really do need to take a minute to commend this industry for how incredible a job they did to be able to provide whatever resources they could as far as personal protective equipment to the frontline workers who desperately needed them before we got that supply chain established. Before we move on, I just want to remind everyone that in case you were late, in case you joined us a few minutes after we got started, that you can ask questions along the bottom of the screen. Please feel free, and we'll try to address them throughout the conversation. There's also some polls that we'd really like you to answer that will help us kind of provide some extra data out of this conversation. We are working to get Sandro back into the conversation as well, having a bit of a connectivity issue with where he's at, but we're trying very hard to get him back involved in the conversation as well. So I want to now talk about, as Andrew, as you told it to me earlier this week, the 3 T's, testing, tracking, and tracing. And I know that tracking and tracing has been a bit of a controversial issue amongst the general public, trying to decide whether or not, they're willing to have their personal data used to be able to help trace where the virus is hit. And I'm just wondering, as far as the construction, so I know we've seen places like Alberta where this is voluntary in the construction industry, and I'm just wondering, where are we in Ontario as far as the potential of using tracking and tracing on construction job sites to try to keep a better perspective on where this virus is hitting and who might be impacted? Not sure which one of you two want to take that to start, but
I wouldn't mind.
Okay, go ahead, Andrew, please.
Okay, so I guess the question becomes, and as outlined in Enzo's documents, when you have an incident on site, the first thing you need to do is notify Ministry of Labor and Public Health, because this is a health emergency, it's a health crisis, and that's where you start. And so I think everybody knows what testing is, and you contact public health to do that. And obviously there's been announcements from the government to expand testing in the last couple of days. So I think that more or less is fairly straightforward. The next is tracking. And so there are requirements by the Ministry of Labor that employers notify MOL, the Union Joint Health and Safety Committee, of positive tests within 4 days. Obviously, if you get the results back quicker, I don't think you need to wait 4 days. I think this is something you want to do as quickly as possible, because the better we can track, the better we can contain the virus. Now, tracing is I guess the newest of the 3 T's, and it's really gained steam in conversations in the last 2 weeks. So tracing, there's many ways to do it, but probably the most popular way, and South Korea was a bit of a leader here, is most people have a smartphone, and on your smartphone is Bluetooth. And that Bluetooth talks to other phones. And so the idea is you can download an app, and there's lots of them out there. And the idea is through these apps, your phones will talk to each other. And so if I'm on site with Enzo and Andrew Macklin, and for some reason I test positive for COVID-19, the app can tell me if I've been within 6 feet of Enzo or 6 feet of Andrew. And potentially it can also tell me what part of the site I was on. And so in the fight against COVID-19, tracing really takes it to the next level. It lets us be proactive, and it lets us really improve how we track, the speed at which we track, and it really can create a testing roadmap. So obviously, if you have this tracing technology, you know where an outbreak was on your site, you know who impacted it, who is impacted, and you can obviously get those people tested a lot quicker than going to site logs or calling people, or, if a builder has 20 trades on site, that's 20 phone calls. Then each of those trades has to figure out who was on site. So there's obviously privacy concerns, and obviously we've talked to our union partners about this, and I don't think we have a clear plan yet, but we're all working towards it. But I think it's something that can really help stop the spread, and there's an emergency order on right now. We're in a pandemic. I think special times call for special measures, is my opinion. And so I think tracing is coming, and I think it's very much needed. And I think it can help keep people safe. It can help save lives, but it can also help us reopen the Ontario economy in a safe way.
Perfect.
I'll talk. There's a little bit of background noise. I apologize for that. I think Andrew's point is well taken with regards to the tracing and how that can help. But for companies who may not be at that point now, may not have partnerships that can facilitate that, one of the first things in the guides material that came out from the CPO and the industry and system was, again, the tracking, making sure that if someone did report in, to collect that information. And I know it's a little bit harder with all the logbooks and everything, but for bigger sites, but for many of the sites that are smaller, more manageable in that manner, where people are working with family or with friends and a smaller community, is to ensure that you do follow up with that, with the people that they may have contacted, or the area of the workplace that occurred in, and ensure that you address those issues right away, whether it's cleanup, whether it's people who have to self-isolate, whatever the case is. But don't forget to do that. So when people do come on site and you do ask the questions, ensure that if they do start to report during that day that they are feeling ill, find out, track it back, because if you're not doing it, you're not doing your full part in trying to prevent this from a community spread as well. So I think, again, it's that social responsibility that we're still working towards, and making sure that it's not only from the employment side, but also on the public safety side. So definitely do it the old style if you have to.
And just to clarify, do we have any clear direction from the Ministry of Labor currently as to where they stand on tracking and tracing? Have they given any sort of directive on its use where possible, let's say, in the construction industry?
I haven't been involved in that conversation with them, no, not that I know of.
Andrew, I'm wondering if, sorry, so there we go. Go ahead, Andrew.
I haven't seen any formal documentation, but the Ministry of Labor and through the Chief Prevention Officer with Ron Koletsky, they have an extensive network, and so they obviously have a number of committees that are talking about a number of issues. And so I'm not part of any specific conversation at this time, but I would be very surprised if this isn't on their radar, and I would be very surprised if they're not talking about it. So I think I don't have the proof for you, but yes, I think MOL is thinking about this and talking about this for sure.
Well, and it's certainly, go ahead.
Well, on the updates every day, we do hear about more testing, and then starting to speak about the tracing piece. So to Andrew's point, I believe that there's probably backroom conversations, at least in regards to how they can do this more effectively.
Okay. And I want to expand on that testing note, because I know that, as we get the construction industry completely back to work and we see more and more people active on job sites throughout Ontario and across Canada, testing becomes a greater issue, and access to testing certainly becomes something that we need to truly appreciate. And I'm just wondering, as we look to figure out more ways to actively test the construction industry to take that next level of health and safety, is there a system that we can put in place that makes the most sense for ensuring that we get the amount of testing we desire for the construction industry? It's too bad that Sandro's not here, because I know that when we had our initial conversation, Sandro had mentioned the fact, we've got a lot of empty shopping mall parking lots across Ontario and Canada, and some of those with a big tent somewhere in the middle of the parking lot would be a great place to be able to drive through it and do a test. I'm just wondering, guys, just your thoughts on what is that testing regime that you're either is hoping coming down the pipeline, or you see coming down the pipeline from your perspective, in order to make sure that the construction industry can do as much as humanly possible to make sure it's as safe as possible. Andrew, do you want to take that first, maybe, and jump in?
Sure. So I think testing is excellent, and we need it, but I think it's part of the safety system. So when we look at WSIB data, they just released some more data, I think at the start of within the last week. We still don't have any compensable claims in the construction sector. When the announcement was made to reopen construction, I think both Minister McNaughton as well as the Premier were quite complimentary on construction, and I think that reflects a lot of the work that people on this call, but also health and safety committees across the province, has done. And so the only reason I raised that is not necessarily to pat construction on the back, but when we're looking at this pandemic, we have to look at the hot spots. And so I think we need to figure out testing in nursing homes, hospitals, and healthcare settings, and we need to let them take the lead and take the resources first. And then construction, and we're not always good at this, we need to wait our turn. But that's where tracing becomes important, because construction is also not immune from COVID-19. And that's where, when a positive case comes in construction, that's where, tracing will come. It's a matter of time. I don't think it's whether or not we're going to do it. I think it's when we're going to do it. And then using that tracing data is how we do the testing. And so obviously we need testing in construction, but we're not more important than healthcare. And so they've got to do, the industry-wide testing first, and we have to wait for that to roll out. but we also need to make sure our job sites are safe. And that's why we need the robust tracking and tracing. And when tracking and tracing shows that there's an outbreak, we need to get, pretty much everybody who needs to be tested. And I think there's big support from the Premier on that. I think there's big support from the Minister of Labor on that. And I guess that's the approach that I see. And the only other thing I've learned with COVID is take things one step at a time. And so, once healthcare gets the testing they need and that's done, then I think we have to have the conversation at that time. Because if you try to get too far ahead of yourself with COVID, you end up being less effective because the world seems to change every week. So.
Yeah, and agreed. Agreed that the hotspots are really critical here, and I know that the government is working on releasing some information around the hotspots in the province. Data is really important. Having that knowledge as to where some of these hotspots are. So again, it's not necessarily a construction issue; it's more of a community issue. And whether it's construction happening in those communities, that may be at a greater risk. So getting that data from the government, I believe that something is forthcoming in regards to that from the announcements earlier this week, that we'll have better understanding. And people are people, and I don't think people want to be necessarily tested if they feel good, but if they know there's hotspots, if they know that there's a community-based spread, that certainly they want to be sure of maintaining their health and safety as well as their loved ones and their colleagues. So I think data is critical in this manner. And to Andrew's point, hopefully the high risk sectors are the ones that are getting the attention first, and the testing that's needed there because of the what's happening in those sectors, and then start to identify those areas that are of higher priority from a community-based perspective. So we'll rely on the data, and we'll hopefully have some data very shortly, and be able to act on it appropriately at that point.
Absolutely. It's unfortunate, like I said, that Sandro's unable to rejoin us. He's apparently having some connectivity issues, and he apologizes for not joining us. But I do want to talk about a significant part of what he's doing, which is training. And we cannot talk about health and safety in construction without talking about training and talking about what exactly is needed. And I believe, Andrew, it was you who we were talking about earlier before, and training really comes to prioritizing right now. And it's being able to understand what needs to happen first, and being able to set aside certain training regiments to realize, just like you said, with the priorities for testing, there are certain things that need to come first, and everything else can wait its turn. And I'm just wondering if you could kind of expand on that from a training perspective, Andrew. That would be great. Hold on, just got your mute muted. Oh, there you go.
For the audience, for background, I also have the pleasure of sitting on the 183 Training Trust Fund. And so Sandra is the executive director, but I sit as one of the board members there. And so I am well aware Sandra sends out a weekly update to all board of director members. And I think 183 deserves a lot of credit for what they've done. And so when it comes to prioritizing, they've really prioritized health and safety training. And it's not that skills training isn't important, but right now it's not as important as health and safety training. 183 and the 183 Training Center have really taken a lead when it comes to moving resources online and virtual learning. They've also come up with plans that take into account requirements like physical distancing when it comes to working at heights. And so I know they're looking, and I don't know if they've launched yet or not, so it's unfortunate Sandra's not here, but they've got plans to launch working at heights and some of the courses that are required for health and safety reasons to get workers back on site. And I know Sandra's made the commitment that the training center will not be the obstacle to getting a member back to work, or staffing an employer with the people they need and the workers they need on site. And so I think that commitment is fantastic, and it really shows how important the labor management connection is during this time. Immediately, we have to praise the government regulators. They came up with solutions so that people could continue to work in a safe way. And so one of them was extending the length of time in which working at height certificates are valid. And so I think they extended it, and Enzo, correct me here, at least 6 months. and most other regulators kind of followed that suit, whether it was TSSA or whoever it was, and we're talking propane, different things like that. As we realize that this pandemic is not going to be essentially resolved until we have a vaccine, we need to start looking at what training we're going to need into the fall. And so as the weather gets cold, we need propane training. And so how can that be delivered? Can it be put online? Is there ways to do it with social distancing in the classroom? And I think obviously health and safety has to take the priority. But as this pandemic drags on, I think we also have to think about skills training as well. Because as BuildForce has reported, pretty much year after year, 100,000 people are going to retire in the construction industry in Ontario, give or take, a couple thousand. And I don't think that's going to change. Obviously, this pandemic's kind of changed perspective. And health and safety is obviously number one, but we won't be able to forget that skills training forever. So we'll have to figure out how to do it safely. And I've known going on for a bit here, but I think people are starting to look at past pandemics to look at what the answers are. And so whether it's the Spanish flu, but I've also seen a lot written about the AIDS pandemic now, or the AIDS pandemic. And essentially people are starting to look at how do you create a world in which you can operate as normally as possible in a world with a pandemic. Oh, good, we have Sandro back. So I'll wrap it up here because this is really his spot to shine. So,
Sandro, welcome back, my friend. It's great to have you. Oh, hold on. We'll just get your mic unmuted here, Sandro. Hopefully this works out. Hold on one sec. Just get your mic unmuted and hopefully we'll be ready to go. No, we're just getting them here. Hold on. There we go. Try it, Sandro. No, hold on. Hold on. Let's get you. We'll take care of this on our end. We're just getting them back in. Hold on a second. Sorry, Enzo, do you want to make a few comments while we get this sorted out? This is great. Connectivity of the internet. You gotta love it when every single person in the entire province needs to be connected to a device right now.
Right on, and thanks. I'll pinch hit for Sandro. He'll owe me one later. With regards to health and safety training, certainly it's very critical. It's going to change in the world going forward. We see it. We're a training deliverer as well. We do 60,000 participants a year or workers a year, and that's going to change significantly. Our class sizes are going to be chopped down to allow the physical distancing in the facilities that we have. We'll have to reduce the class sizes. So industry is going to have to be a little more patient because the volumes, I think, whether it's ourselves or whether it's a private provider, the physical distancing requirements are going to be there. Certainly, we've expanded and tried to move online where possible, where the hands-on, per se, skills integrated training with health and safety aren't a part of the course. So if it's a pure classroom version course, we're all looking, and Sandro, I know, is working towards that. We are, other training providers are looking at doing a distant learning delivery as well. So we're all moving in that direction where we can expand reach and expand use, but the in-class where there is a skill component, that's going to have to be physical distancing at its best and making sure that we can continue to deliver on the outcomes of the training, but maintain the requirements. So again, class size is going to be smaller. Number of classes in a facility are going to be less, again, to adhere to the requirements. In our case, prioritization of the courses as well. Which are the ones that have are going to prevent people from working, like working at heights. So in our case, we are going to start doing working at heights with limited to 4 participants and 1 instructor. So we've maintained the 5 emergency order requirements in the facility. So nobody else in the facility except 5 people, just to get it started, to get it moving, and to try and to meet some demand in the industry. So those kinds of things are going to be moving forward as things migrate and get hopefully released, and as the numbers get better, we'll be able to expand on that. But it's to go back to the normal until you do have a vaccine or some other resources to really minimize the risk. We'll be in that world, and we'll be asking for some patience and for people to use the other technologies available to them to get some of this training, the health and safety training. But just to answer the question around some of the priority or the expiring working at heights cards, there have been extensions by the ministry as well as in the utility sector for mandatory training, certainly on the propane and TSSA. I haven't seen anything specific, but I don't believe they're going to go after you if you haven't had your renewals of your training. If you haven't had the training, it's one thing, but for the renewals, the extensions are certainly in play.
Okay, thank you very much. So we've got Sandro back via video, but unfortunately we're now having microphone issues with it. So yeah, you can see him just shaking his head, and like I said, the beauties of technology and how frustrating that we all know it is. Of course, anything that can go wrong will go wrong. I think we all know that one all too well. So let's actually, what we're going to ask Sandro to do is maybe provide us with some comments in the chat. So as we're having our conversation with Andrew and Enzo, I'm hoping that Sandro will throw his 2 cents worth in the chat and be able to provide us with some information. So we'll let Sandro build on what Enzo was talking about as far as the steps that he and his team at the LIUNA 183 training centers are doing to try to build the most safe classroom and building environment humanly possible to be able to get some of this training regimen back in place. While he's doing that, Andrew, you talked about this several minutes ago during our conversation, and Enzo, the other day you were talking about online videos that you guys were working on for best practices, and I happened to go on your website, and for anyone who hasn't been there yet, ihsa.ca, if you go to their website, you will see in the top right-hand corner a YouTube link. And if you click on that, there are several videos that provide you with best possible industry practices for doing so many of the important new health and safety regimens that we are dealing with. And Enzo, I'm just kind of curious, you guys did that very quickly, all things considered. What was the process like for you guys to just try to be able to provide those online resources? Because obviously, as Andrew commented earlier, getting this information to everyone is a challenge.
It is, and again, there's so many resources out there, and we identified quickly that what are the basics that people need to see in very short order, whether it's a worker, whether it's a supervisor, constructor, employer, whatever the case is, that they can then learn from and bring back to the workplace. It visually is so important. So we got our staff in, again, limited staff into our facilities, shot all the video within a week or so, and they worked very diligently to get it out there. Our sister associations are also coming up with some other short videos as well on different topics that we'll share as a system, again, to fill the gaps where we still haven't finished some of the other videos, or we're still moving on some other topics. But it's, again, critical to have visuals and for people to see, how do you take off a glove, put on and take it off safely? Because again, when it gets on your hands, that's the risk. That's a huge risk with this virus, is getting it on your hands and not sanitizing properly. So simple things like hand washing, taking off your gloves, cleaning your vehicle, those are important items. And especially on a site conditions where you may have limited resources, how do you do it with the resources that you do have in a very effective manner? And that's the essence of these 4 or 5 videos that we've recently released, I believe a day or two ago. So we'll keep on doing that, and hopefully the industry picks up on it and shares it as widely as possible.
And obviously, to anyone who's not from Ontario, I mean, these are universal. Use them everywhere. This is a fantastic resource for everyone. And Andrew, it must be very helpful for you, knowing your members, to be able to point them in a direction where they can get such easy access to basic but very important new health and safety procedures.
Yeah, I think something that's really emerged is, I think everybody in health and safety knew how good IHSA was before this, but now I think the secret's out and kind of everybody across the province knows. So we're very lucky to have IHSA in this province. And when we look back, because I think we have to look back at some point at what happened during this pandemic to plan and look at what we can do moving forward for, unfortunately, future pandemics. It looks like at some point in the future we'll probably have another one, or we should at least be prepared for one. But having IHSA there and the resources that they have was incredible. I think the other thing that I was really impressed with was the amount of information sharing that went on with ResCon members. I probably, at one point we had a health and safety call, and there was almost a request, I can't look at anything else. We have so much stuff out there now, and it's all so great, is we have to organize and catalog this. we're all connected, which is fantastic, and there's lots of sharing, and it really got to, we had the information what we needed, and how do you organize it so that people can access it when they need it in a quick and timely fashion. And I know Sandro can't speak up, but 183 has been very good as well with providing resources to their members and employer partners, and I'm very proud of that as a board member. They're very active on social media, and so their platform on social media, follow them on Instagram and Twitter, is phenomenal because it takes a lot of the best practices from IHSA and from labor management groups, and it simplifies it to a picture. And sometimes just reminding somebody to wash their hands is very important. And I think back to some of the other successful health and safety campaigns, and I think we need to start using them going forward. In my favorite one, and I'm sure everybody's seen it, is remember back when you were stuck in traffic jams, and some of them were because of construction. Those ones never bothered me, but you'd see a sign that it said, "Slow down, my mom or my dad works there." And so I think humanizing all of our efforts is very important. And I think we need a campaign like that for COVID. Did you wash your hands? And did you wash them properly? As a guy, I think it's statistically, men are not the best hand washers. I certainly, before COVID-19, did not take 20 seconds every time I washed my hands, and probably, did not wash my hands the same way I wash them now. And so everybody needs those constant reminders, and we all need to work together to keep everybody safe. And some of those successful campaigns in the past, I think we can reuse them and reuse the themes that worked to kind of tackle and beat COVID-19.
And I think you're right. When you talk about the humanizing campaign, you're right. That campaign for flag persons on those highway construction sites, we've certainly seen be very effective. I'm thinking about jurisdictions like Alberta, Saskatchewan, and Manitoba, where they've had those campaigns, and they have been highly, highly effective to get people slowed down. Unfortunately, as a result of some very tragic incidents that have happened in the past. I just want to take a quick minute to talk about PPE equipment, because I know that personal protective equipment is a bit of an issue. And I just want to know whether or not that supply chain has been reestablished, and whether or not we have what we need in place to be able to get masks and the amount of protective equipment to the construction industry in a timely fashion. Have we got that supply chain strongly established? Because to the earlier point, we gave away as an industry so much of our stockpile to help everyone on the front line. Are there any concerns now for the construction industry to be able to get that supply back in a timely fashion so that we can reopen all of our construction sites and have the safety equipment we need? Enzo, maybe you want to jump in on that first for me, please?
Yes. Certainly when it comes to materials like hand sanitizer, gloves, face coverings, I know we've had a lot of success in getting them fairly short order. So again, kudos to the industries that have stepped up, whether they were the spirits industries who came up with the hand sanitizers early on, and now they're pretty prevalent as far as the stocks go. Facial coverings, same thing. Many people have jumped on that. If you're looking for specifics around, N95s, the respirators, I don't want to call them face coverings, but respirators, N95s and better. Again, we should be careful about only using them for industry specific hazards where a respirator is required. But those supplies, again, limited as they continue to be, should be reserved for the healthcare sector, and not be confused with face coverings or face masks that aren't used for the purpose of personal protective, reasons. But as far as the stocks go on the N95s of the respirators, again, maybe Andrew, you've got a better sense of that from the industry, but the other, besides the actual respirators, it seems like they're coming online, and companies are able to access that. Soap and water and cleanup facilities surely are getting better by the day as well. So,
Andrew, can you provide us with some extra insight on that?
Yeah, I think it's a great question, and I think this is a very different answer than I might have given in mid-March, but I think we have a lot of PPE in Ontario right now, which is great. I know I had sent in, and I don't know if you can click on or send it out in the comments, there are 2 websites that I'm aware of in Ontario. So if an employer needs PPE, There's a government website out of the government of Ontario that helps link employers with PPE suppliers. And then there was a second one, and the provider is slipping my mind at this point, but I know I can find and we can send out to this group those two websites that will help match them with PPE. This question brings up two thoughts that I missed earlier on. So when I talked about masks and face coverings, Enzo pointed this out. I am not talking about a construction activity that requires an N95. If you require an N95 or a respirator before COVID-19 to do the work safety, I'm thinking about, any work. Obviously, when you're removing asbestos or there's other construction activities in which respirators are required, obviously you need to work safely, and those requirements are still there. My comments were more of, a person who's not before COVID-19 requiring a face covering or mask, and now that they might be working in 6 feet of someone, we don't want that worker using an N95. We want those workers using, non-medical grade surgical masks or a face covering to save the N95 for the healthcare workers. The other issue that I forgot to mention is when you see people on construction sites, we have to remember construction is a family business. There's a lot of trades that are fathers and sons and daughters. And so social distancing, it definitely applies. And then the question is, what happens when you have family members that live together in the same house that go to work together? Is it acceptable for them to be inside of 6 feet without a mask on? My opinion is if you're going to be inside 6 feet, you need to figure out a way to cover your mask, because I think it sends a dangerous message not to. I think it's something that we all need to buy into. We're in this together, and so everybody should be covering their face, especially inside 6 feet. But those are some things there. So, yeah. On the PPE, I think the member donations were incredible. I think this is just another example of how generous the construction industry is. On the residential side, we build homes and houses, but we also build communities. And so, in the last couple of weeks, I've heard of not only PPE donations, but I know Tribute made a $500,000 donation to a local food bank. There's another initiative with St. Clair's multi-phase housing. So this one started, I think, about 3 years ago, and ResCon members and some of our partners, including Liuna, we donated $1 million to help build 22 affordable housing units to essentially help people who are hard to home get off the street. And so, as you know, Andrew, construction, the industry has a big heart, and we are part of the community. We are the community, and I was not surprised to see how much people stepped up to donate. And I don't think we need those mask backs, because we can get new masks and they're available. So.
And just on that note, to everyone who's tuned in right now, please look at the chat on the right-hand side, and you'll see the two links that Andrew was speaking about. They've been provided there. I see Sandro's video, and I'm really hopeful he's back with us. I'm not sure what status his connection is with us right now.
Please tell me you can hear me.
I can hear you. Oh my goodness, it's fantastic to hear your voice, Sandro.
Yeah. Now, before I lose Enzo and Andrew, because what will happen is I'll lose them while I start to talk. My screen goes, their screens go off, but hopefully that doesn't happen anymore. Sorry, everybody.
So anything, I want to open the floor to you for a minute, Sandra. Anything that's been discussed in today's conversation so far that you want to comment on? Because a lot of stuff has been very relevant to you and your members.
Yeah, I apologize because I'm in and out trying to connect, so I didn't catch a lot of the comments, and at the beginning I couldn't hear anything that Enzo and Andrew were saying. So I did hear something that Andrew had mentioned about skills training coming back eventually, and we're working hard with the Ministry of Training. All the LiUNA local training funds are on how to make that happen. There are opportunities for part of the program to be done in a virtual environment to get some of the blueprint reading and math and some safety courses done. But that is, it's a slippery slope when you're dealing with a virus that is contracted between people. So the one thing that we've done when it comes to training in this new world for us is, and Enzo's mentioned about the number of people being cut down and so on, where that's a must. Is I've kind of broken down things into 3 P's, which is protect, plan, and prioritize. So in this world, you gotta identify first who you're trying to protect from obtaining the virus in a training environment. Well, you're trying to protect your staff, you're trying to protect your members, your participants in the programs you're going to be developing. Then you got to plan that, how you're going to do that. And that's where the social distancing, the limiting of class numbers and people attending your classes all comes into play. How are you going to do that? Are you going to be giving them material that's not going to be used again? Are you going to sanitize the classrooms at the beginning and the end of the day? Are you going to have them sanitize when they come in and use masks or gloves, depending on what you're doing? So that plan has to be generated. And then in the end, and there's a lot that goes on in the planning portion of that. And then when you get into the final P, the prioritizes, because you're dealing with something that is transmitted between people, if you go the route of, okay, let's run apprenticeship and skills, if that is the demand, or do you risk something happening while you run an apprenticeship or a skills program where you have people for multiple weeks at your campuses, as opposed to the immediate need right now being the health and safety training for people that are in the industry that require it. So that you're going to kind of juggle that, because something could, it's catastrophic when, if you have an apprenticeship program running and everything's going great and you have, 8 people or 12 people or whatever you're doing, whatever the numbers allow, and then somebody unfortunately tests positive. So then you got to come back and you're like, okay, now does that mean I have to now shut down my entire building? And then when the ResCon people need safety training, can I now deliver that safety training? So you got to kind of, where's the need, and be careful on what the priorities are for how you develop that plan. Those are the things we're looking at. We've developed a plan internally that deals with COVID-19 specifically for staff. We're working on one for trainees that come in. But everything we've done, whether it's the working at heights, Andrew did mention that, our philosophy is you can't have the training in the way of someone going to be able to make a living. So, and Enzo, we've had this discussion as well, and we've, the construction industry is now open. They have done that in the province of Ontario. It is open. Training and everything that comes along with PPE, the Occupational Health and Safety Act, training is a part of all of that. So if someone needs to be at work, you need to now deliver that program, whether it's working at heights, traffic control, whatever it might be for the season. You need to be able to provide that training for someone who needs it, or someone who who relies on it to stay on site as part of the company policy or as part of regulatory requirements. Now, to do that, you need to do it safely. So that's where all the planning comes in. You can't just start running classes of 10 and 15 people. It's not going to happen. We've done things at 183 that are one-on-one. We have our instructors teach one of our members who requires a working at heights because they didn't meet the extension, and they need to go to work. They're able to go to work. The industry is open, so we are now helping our member get there and fulfill everything that's part of the industry and helping our employer partners. So that's some of the stuff that we've been doing. I know, working with great people, our employer partners, our union representatives, the donations. Andrew mentioned that our regional office has coordinated incredible efforts to donate stuff here at 183. We've done some donating of PPE to various institutions that required it. The health professionals, everybody's doing a great job.
Thank you very much. I just want to remind people once again, we've got about 20 minutes left in our conversation. So I just want to remind everyone that's in attendance this morning that please, if you do have a question for any of the 3 gentlemen who joined me this morning, please go into the ask a question portion of the interactive space at the bottom, and please ask a question. Also, don't forget, there are 6 poll questions that have been asked along the bottom, and I just want to put in a quick plug because Andrew mentioned market capacity issues. And for anyone interested, that will be the subject that we'll be discussing in next month's event for the Renew Canada discussion series. We will be looking at the issues surrounding market capacity in Canada. So please stay tuned for details on that one as well. Gentlemen, I want to move into, okay, so you guys have done such a phenomenal job about talking about where we've gotten ourselves to now that we're into the end of May and the pandemic's been going on for 2.5 months. We're getting those job sites reopened. We're almost at 100%, probably in the next few weeks based on the way that the Ontario government is phasing things in. But we're also preparing ourselves for the possibility of a second round or a third round of this pandemic coming. And I'm just wondering, what are you guys doing now? What is it that you guys are doing to be ready for what comes next? Because Andrew, you brought it up. You guys worked as hard as you could to react as quickly as possible. And I'm guessing that while you're doing that, you're now also being able to do some proactive work to be able to put some measures in place. So, Andrew, I'll start with you, but I'm just kind of curious, what kind of work are you doing now to be able to get ready for the potential of what comes next?
So I think the idea is at the start we were, as you said, reacting to COVID-19 as the rest of the world and the entire economy was. We want to move into the management phase now. And so the priority right now is on tracing. And the idea is, let's say we get to a world where there's 50 cases in Ontario. And if we know exactly who has those cases, and if we know they're self-isolating, and we can track, and more importantly, if we can trace where those people are, then through effective testing, we can manage and we can control this virus. Obviously, I think that is probably the most optimistic view, but that is the view I have. But I think the idea is to go from reacting to managing. I think when we talk about a second wave, everybody looks at the cold and flu season. This is an airborne illness, and obviously, it's related to the flu family of viruses. And so I think we need to, as a community, labor management, Province of Ontario, Ministry of Labor, Chief Prevention Officer, IHSA, we need to have those conversations now in May and June, and maybe even a little bit into July, to have that robust plan in place to go forward. So how are we going to manage, especially the fall? And because the symptoms are shared with other illnesses, including the cold and flu, the question will become, we're going to have very strict workplace practices, and they're going to have to be enforced, and there's going to be screening tools, and there's going to be tracing, and there's going to be a lot done to keep people safe. But essentially, we got to figure out a way to maintain the physical distancing, but we also have to figure out a way that when people are sick, they don't come to work. And if you have symptoms, you don't come to work. And whether it's a cold or flu or COVID-19, you shouldn't be on the job site, but we need to be able to track, trace, and figure out what you have, and that's how we'll stay ahead of it. That's how we'll manage it. I think Enzo pointed it out. COVID-19 becomes a problem when there's community spread and when we don't know where it is or where it's going. If we can figure out who has it and who likely has it, and we can manage it and track it and trace it properly, then we can test effectively and we can stay ahead of the curve. I think we've got the foundation we need. There's a lot of work still to be done, but I think the focus going forward is on the economy and figuring out ways to get back to work and get back to work safely.
Before I jump over to Enzo and Sandro to get comment on that, Andrew, I just want to follow up on one thing you said there, which is putting ourselves in a position where if you're sick, regardless of what symptoms you think you've got, if you're sick, you stay home. And I'm just wondering, do we have the policy and governance in place right now to be able to afford people to just be able to say, I'm sick, I'm staying home, without any fear of, losing a job, not being able to take sick days, not being able to lose any ability to support their loved ones by doing the right thing, which is staying home?
So it's a simple question and it's a complicated question. For society, we need people to go home. What we know is every workplace is different and every industry is different. So I think this gets back to the joint labor management committees. This gets back to coordination between the federal government and the provincial government. Obviously, through the federal programs now, anyone who's sick can qualify for assistance. I don't know the length of that program. I don't know what they have planned for the fall, but obviously there is a role for the federal government. There is a role for the provincial government. There's a role for employers. There's a role for unions, and there's a role for the worker. And so it's something that we have to figure out as a group, because nobody can figure out or do this on their own. Because as you point out, we need to be in a position where people can take care of themselves, but we can also take care of the community as a whole. And so COVID-19 has shown that requires a universal approach with all stakeholders stepping up to the table and solving it as a group.
Perfect. Thank you, Andrew. Enzo?
Yeah, so a couple of things I want to just work on with what Andrew mentioned was really between now and potentially a next wave is to ensure that the habits are created on sites in the industry. Again, the hand sanitization, the use of masks or face coverings. We can't let complacency work its way into the industry over the next few months, because when that hits, if it potentially hits in the fall, we got to remember where this whole pandemic started, right? It started with a few people and it just spread like crazy. So that could happen again. And the worst thing we can do is to be satisfied that it's gone, and do things as we pre-COVID did. And that's not going to work, right? So we have to look at the new reality. And the new reality is sanitization of hands, the distancing as best we can, and control bodily, droplets and all that from sneezing and coughing. So definitely have to bolster the culture, bolster the habit building over the next 2, 3, 4 months in preparation. The other thing is when it comes to companies' policies and procedures and use of the Joint Health and Safety Committee, utilize that now, embed those good practices in your everyday practices. And again, monitor, evaluate, and enforce. And that's going to create those habits, it's going to create that culture, and be prepared for the future for it. Treating COVID, I think Andrew mentioned it earlier, is like any other biological risk, and treat it that way. And if you have the good, strong procedures around it and everyone's practicing those procedures, I think we'll be set for being prepared for a next wave. But certainly, let's not let complacency fall into place here.
Thank you very much, Enzo. Sandro, your thoughts?
I agree with both gentlemen. The comments that Andrew and Enzo have made. I think that communication also, I would throw communication being extremely important with how you're going to build the habits, the positive habits and the positive structure that's going to carry us into the months ahead. Communicate constantly with your staff, with your employees, people that are coming into your building. The structure of how you operate needs to change. When it comes to this, you need to build this into your employees' daily, or your employees, members, trainees, whoever it is. Build it right into their daily lives on how they function. We've done some of those things. Like I said before, we built a guidelines and protocols document for the staff on how we're going to operate. They've done a great job, and we need to continue building that and communicate that on how we're going to do that. The COVID, sanitation, everything around COVID needs to be built into what you're doing, as Enzo said, to build habits so that 3 months and 5 months from now, it just becomes second nature, because that is the world we're living in right now. It's becoming easier and easier not to shake someone's hand, right? You just get used to it. So if you get used to, when you come into a building, you're going to sanitize. When you're leaving the classroom, you're going to wash your hands. When you're going here, you're not going to keep this. You're going to throw that out. And if you continue to build that every day and communicate that to your people, hopefully that's where you get into building positive habits. And again, in collaboration, Andrew mentioned, it's going to take everybody: government, federal, provincial governments, labor management, safety agencies. Everybody's going to have to work towards the same goal, and protecting members and protecting workers. The industry's done a really great job with this. The employers have been great. The unions have been great. Government's been good in most areas. So that needs to continue, and I think it will. I think that we're hopefully going to turn a corner. We've learned a lot of things. Tracing, once the obvious stuff around privacy gets worked out and everybody can be content and kind of not nervous about stuff like that, I think tracing is going to be part of what we're going to do, and important on tracking future breakouts.
All right, well, we got under 10 minutes left in our conversation, gentlemen. So I was wondering if potentially we could get some final thoughts from the three of you, just, kind of lasting messages, what people truly need to come away with when they consider, what the new health and safety regime really is for construction, and what we need to be ready for in the months to come. Andrew, start with you. Some final thoughts on, what people need to take away from this.
So first off, I am just overwhelmed, impressed with the health and safety professionals that I get to work with, whether it's my board members, the Health and Safety Committee, and the ResCon members. So I think the first thing is a big thank you to everyone who did all of the on-the-ground work. Working in policy and interacting with IHSA or government is easy when you're supported like I am through the membership and the committees and to Sandro and to 183 and our labor partners. So first off is thank you. Kind of final thoughts. I find the poll questions very interesting. So the overwhelming majority, what are the challenges for construction health and safety right now? Inability to maintain physical distancing. I think that was my understanding and expectation, and that shows. And I guess I'd thank the audience, because this information is also very interesting for us as presenters. So thank you there. Final thought is, this is about implementation. It's about fighting complacency, and it's about how do we go from reacting to the policy to managing it. And if you take away anything, please look at the 3 T's and figure out how you can implement them in the right, safe way where people's privacy is respected. But we're in this together, and extraordinary times call for extraordinary measures. So we need to figure out ways to track, to test, and to trace on site. And we need to figure out ways to keep people from becoming complacent. And that's going to require efforts from everybody. So that's my final thought.
Thank you very much. Andrew, over to you, Enzo.
Thanks again. I want to echo Andrew. Really want to commend the industry, the system, the industry, our staff as well, in working very, very hard and together. And I think the key part here is collaboration and working together on this, working like a community in regards to this issue, and as we do amongst other issues within the industry. So again, thanks to everyone for that effort. When it comes to last words, I think the issue here is, again, creating those habits. Start off with your policies and practices. As small business owners, as big business owners, think about your social responsibility. I mean, that's a key element here is yes, your business needs to be viable, needs to move forward, but we also have to, whether it's contributing our resources as the industry did with all the PPE, but it's also about contributing the habits to the industry. So that's the one piece that I think we need to continue to implement, is those habits. And not only for if you see others as employees, as employers, as constructors, people that you deal with every day as an association, if you see others not complying, as we heard earlier, is to reinforce the need for it, whether it's at the personal level or whether it's for a business level, is to reinforce it, to create those habits so we can deal with it. And as we create those habits, we're going to see probably a safer environment when a regular flu hits or a regular cold season hits. So there'll be benefits down the road. So maintain vigilance around sanitization and building those habits and creating the environment within the company to support this, whether it's through your policies and practices and the use of your health and safety rep and the use of your joint health and safety committee. And resources, as we have, as well as the unions, as well as the associations have, to promote and to prevent and to help get that understanding and communication.
Thanks, Enzo. And Sandro, as you deliver your final comments, I'm just wondering if you can also, there was a question earlier from when you weren't online, and I'm hoping that maybe you can give some input on this as well, and just asking about training for workers that's available online. What you guys have done as far as setting up some of your training mechanisms online, and then perhaps you can go into your final thoughts from there.
Sure. We've done 2 things when it comes to the online training. We expanded some of our online offerings, working with Enzo and the IHSA, partnering with them on some programs that are available right now for our membership. And we developed a live remote virtual learning platform that we're using for a number of programs that don't require a hands-on component. So stuff like machine operating or the working at heights and so on, propane certification and stuff. But stuff like confined space, trenching, traffic control, WMIS, PPE, housekeeping, all of those things, those are available in a virtual remote learning software that we've put together, and it's up and running, and it's taking off. It's not the same for our audience. So, you run into connectivity issues and stuff like today, but we have started to offer that, and it's working out decently so far. And we're proud that we were able to turn that around so quickly. It's been tough, and just the entire industry being able to turn things around and shift direction so quickly is really kudos to everybody in the construction industry. So in closing, I would say, I apologize again for the connectivity issues. I thank Enzo and Andrew for their ongoing support. I thank the LIUNA leadership for their support in the training world and what we do. I would say coming at it from a training perspective, Enzo would know this, that, you know, we see a great deal of people, a lot of people come through the HSAs and the union training centers in the province of Ontario. So have those protocols in place, develop your guidelines, have the protocols so that they're strict and straightforward. The structure needs to be put in place, build the good habits so that you can safely train people that need training. Don't rush anything, don't overwhelm things. You need to be responsible when it comes to rolling out anything that you're doing, in where it involves people, and people being in a space for a day, for 6 weeks, for 3 days, whatever it is. The planning that has to go into that needs to be thought out carefully and methodically in order for it to be safe for everyone to be involved. So those would be my final thoughts, and that's where we're focused on right now.
Well, thank you very much, gentlemen. Andrew, Enzo, Sandro, thank you very much for joining me today as part of today's presentation. I greatly appreciate all of your input on what is a crucial issue in our industry moving forward. So thank you very much. We say goodbye to them. And just before we leave, just want to provide you a few reminders. First of all, a summary of today's conversation will appear as part of a feature story on Renew Canada's website, renewcanada.net, in the days to come. And then a full synopsis of today's discussion, including, I'm sure, additional feedback from Sandro, will be featured in the September-October edition of Renew Canada. I want to encourage you to follow Actual Media here on Crowdcast for information on all of our upcoming presentations. We host an online discussion just like this the fourth Thursday of every single month. The next one upcoming is June 25th, where we'll be talking about addressing market capacity in Canada. However, stay tuned. We've got an exciting announcement about another discussion that we hope to be having in the weeks before our June 25th discussion. So, of course, follow Renew Canada on Twitter for the most up-to-date information, not only on the discussion series we're having, but on all things related to the public sector infrastructure industry in Canada. And just a reminder that, yes, within about 4 to 6 hours from now, you should be able to revisit this link to be able to watch the presentation once again. On behalf of my entire team here at Actual Media, and on behalf of our speakers, Andrew, Sandro, and Enzo, I want to say thank you very much for joining us today, and we look forward to having you at our June 25th event. Thanks.